You know, there's a piece of legislation that's in the House that just got passed, and you would have thought this was a piece of legislation that didn't need to be passed. Like, this is an issue that should be addressed. It's the H.R. 918, the Veteran Urgent Access to Mental Health Care Act. Now, what this act does is it provides mental health assessments and mental health care to veterans with other than honorable discharges. These are for people who have been deployed and served in combat zones. Combat zones. Generally, individuals who have such discharges are not eligible for any veteran benefits. So if you get dishonorably discharged and you're a combat vet, you won't get benefits from the VA. May 2017 Government Accountability Office report found that 62% of the 91,674 service members separated for minor forms of misconduct from year 2011 to 2015 had been diagnosed within 2 years prior to separation with PTSD, TBI, or other conditions that could be associated with their misconduct. So what they're saying is many of the people who are discharged with less than honorable discharge, who don't get VA benefits, they had an issue, a mental issue from actually being in combat. And these men and women, these servicemen and women who are in combat are being denied benefits. I don't know what to say. Every day, 20 veterans commit suicide. Every day. Tulsi Gabbard supports this legislation. She was on the House floor. She spoke about it, and I'm going to run you that clip.
Our country owes them a debt of gratitude, something that we're often reminded of every year around this time as we head into Veterans Day. But unfortunately, too often, our fellow service members are coming home and they are being prevented from receiving the care that they've earned through their service. They bear the brunt of the human cost of war, with an average of 20 veterans committing suicide every single day. Their families carry this sacrifice and this cost throughout their lives. The rate of mental health and substance use disorders has been steadily rising since 2001. This legislation is bipartisan and would require the VA to provide urgent mental health care services, including an initial mental health assessment to veterans who've participated in combat operations or who have survived sexual assault or harassment. It would also expand those services to those who received a discharge under certain other than honorable conditions, who haven't received a character of service or discharge determination yet. We've heard already about the high numbers of veterans who fall into this category and about how negatively this discharge has affected lives. When they come home, they're working on their transition to a successful civilian life. This discharge takes away their access to health care. It takes away their access to services and benefits that they have earned through many times multiple deployments. Services that are in place to help set our veterans up for success upon their return home. In addition, this bill would require the VA to provide services at non-VA facilities for veterans who live in rural or underserved communities. I can't state how important this is enough, because it affects those veterans in my districts in places, in different islands in the state of Hawaii, who are separated literally by a body of water from the VA clinic. The Veteran Urgent Access to Mental Health Care Act would also mandate the VA to provide additional information for mental health services for veterans and to ensure that they provide annual reports to Congress on those services that they have been providing to our veterans. This is such an important piece of legislation. I urge all of our colleagues to stand up and support its passage and see it through to its enactment, because we cannot afford to leave our men and women in uniform behind.
Man, I don't even know what to say to that. You know, instead of being worried about people standing to salute a flag, we should be worried about this, about veterans who have PTSD, who we deny benefits to, who have served combat. There should be a law against being a damn hypocrite. That's all I'm saying. We love the vets. We love the vets. And I'm not talking about regular Americans, average Americans who are not veterans, who may not have veterans in their family directly that know about this situation. But I'm sure there were politicians who knew about the NFL protest and knew when these people were saying, you don't love the vets, you don't love the vets. They knew that there were veterans who not even getting treatment, who were in combat. This ain't a loophole. This ain't an accident. They intentionally have been neglecting veterans. This bill passed the House. It should pass the Senate. But we shouldn't forget the hypocrisy of our democracy.